All right, next on our agenda, 6.7 or 9:50 a.m., consideration and discussion of the resolution of formation declaring the formation of the Lake County Hospital Improvement District. And we have Mr. Ben Rickelman. All right. Good morning.
I don't think your mic's on.
Is it green?
Good morning, Board. Ben Rickelman, Deputy County Administrative Officer. I'm here once again.
Keep going.
Test.
Fine.
Okay, that's good enough. I'm here with the Lake County Hospital Improvement District. So this is a 4-step process, and thankfully we are at the last step. With a business-based assessment district with state law, you have to have a resolution of intention, public meeting, public hearing, and then the resolution of formation. And then I will say after this process, if it's approved by the board, it'll be brought to the California Department of Health, and they will look through it. And then it will need also federal approval with the Center of Medicare and Medicaid Services. So I included this slide. At the public hearing, there's a request with the annual report that will be provided to the board to show with Sutter Lakeside and Aventus Clear Lake how the rates for care will work versus the systems as a whole. So we have, this will be one of the reporting metrics, and you'll have this comparative analysis showing if there's any impact with this. And then also at the board's request, we did include a slide for the annual report that will also just show service volume. So this will have both inpatient and outpatient for the two hospitals. Those were the only edits since the last meeting. So we did incorporate with the treasurer tax collector taking the 1% assessment fee for management of the funds, and everything else has been left the same.
Anything further? I want to invite the hospitals to potentially come up and make a comment before we bring it back to the board. You don't have to if you don't want to. Okay. Any comments or questions from board members? Supervisor Green.
Just my vote today will be consistent with prior votes on this issue, and it's no disrespect to those involved, and thank you, Mr. Rickelman, for your hard work on this.
I do have a quick question. Doesn't change the outcome, just curious. So we're looking at potentially, if I remember correctly, 16 million, which the 1% I'm guessing would be around the 160. And that's per year, correct?
Correct. So
where does that money go if it doesn't get spent in dealing with the collection and disbursements to the hospitals? Does that go into general fund? Does that go into any specific category? Does that go back to the hospitals? Just kind of curious. And what also happens if we find out that we're actually expending more than that 1%? Do we have the ability to amend within the 5 years that this has been created? I was just curious about that because I didn't have any details.
So we could amend the management plan. It would just have to come back to the board, so that could be adjusted that way. I would want to confer with Patrick. So this is a separate pot of money, so I don't think there's like an easy way to transfer to the general fund if there's surplus, kind of how the TID operates. So usually assessment districts are firewalled as their own kind of financial kingdom. But I will check with Patrick kind of what the processes would be if the 1%'s more than enough, or if we would need more. I'm doubtful. I'm extremely doubtful that it would be insufficient.
Me too.
Since it's only 2 entities, it should actually be significantly more, less of a burden to administrate than the TID. I mean, you only have 2 entities and they're willing participants, so you're not tracking down money or going through enforcement.
Okay. It'd be nice to, I guess, review that after a full year's worth of practice to see where it is and what does eventually happen to those dollars at the end. But that was my only curiosity. I really appreciate the update on the reporting. I think it fits exactly what was requested by the board and ready to move forward. I guess my last question is, I've been following what's been happening at the city of Clear Lake because they're the other jurisdiction that needs to also approve this. Did they approve all the way through step 4, or do they still have 1 step left to do?
So all the city of Clear Lake had to do was pass a resolution of consent, which was an attachment. So they did pass that back in September. And then so for a business-based assessment district, since the hospital's in Clear Lake, they have to do that. So it's acknowledged in the resolution that the city passed it, and that was the only action they needed to take.
So different process than what we're following.
Correct.
Thank you very much. Let's go ahead and open it up for public comments regarding this item. Anyone wish to speak on this item? Come on up to the microphone or raise your hand in Zoom. And seeing none of the above, I'll bring it back to the board for action.
I'll offer the resolution.
Resolution's been offered.
Supervisor Simon?
Yes.
Supervisor Crandall?
Aye.
Supervisor Green?
Nay.
Supervisor Pyska?
Yes.
And Supervisor Sabatier?
Aye. Thank you very much. I also will say a first in the state of California, I believe. Yes. So let's see how this works out for the benefit of the community. Thank you so much.
Thank you.